Welcome back. Michigan health officials say cases of an intestinal infection are still climbing. More than 11,000 have been linked to the outbreak there. Yesterday, Michigan reported the first 2 deaths from this illness. Dr. Céline Gounder joined us now to discuss. Doctor, deaths always scare and rattle people, understandably so, but this cyclosporiasis is not typically, almost never fatal. So how should we think about these 2 reported cases?
So what we're hearing about these 2 cases, Major, is that both of them had significant underlying medical conditions. If you're somebody who's elderly, if you have chronic kidney disease or other medical conditions, anything from diabetes to heart failure, if you have dementia, these are all conditions that can put you at risk for more complications from severe dehydration. So it is not surprising that there would be a couple deaths related to cyclosporiasis through severe dehydration, but it is not common for this infection to cause somebody to die.
So I remain curious, Dr. Gounder, why we are as a country having such a difficult time tracing the source and tracking accurately the number of cases. Can you help us understand that or wrap our arms around that?
Yeah, so there were a number of cuts, as people will remember, to public health programs last year, about a year ago, that included cuts to the CDC, cuts to the FDA. And those are important programs in terms of monitoring our food supply. There was a program called FoodNet that used to monitor for some 8 different pathogens. That was cut down to 2, only E. coli and Salmonella. One of those that was cut from that program was Cyclospora. That program provided us with a baseline so that we would be able to pick up more quickly if there was an increase from baseline. There's always some level of cyclosporiasis, but not big outbreaks like this. The other key piece here is that there has been an FDA new rule in the works for some time now that would facilitate some of this investigation. So a requirement that detailed tracking records be kept so that these foods, contaminated foods, could be traced within 24 hours rather than in weeks. That rule was supposed to take effect in January of this year. And then in March, it was announced that that was going to be delayed until 2028. And I just want to note that it was right around that time that Taylor Farms also made a $1 million donation to a pro-Trump super PAC. We don't know if there's a link there, but that donation was made right around that time.
And Taylor Farms is what the FDA says is the possible likeliest source of this outbreak, correct?
Yeah, everything still points to Taylor Farms, iceberg lettuce. The problem is Taylor Farms distributes its foods under many different labels and through different food distributors. And so it's not always labeled Taylor Farms where it would be so obvious to the consumer shopping in their grocery store.
And we've discussed this before, Dr. Gounder, but a quick reminder, rinsing your produce doesn't save you from this, but it's still a good idea, if I read your memo about this morning correctly.
That's right. So rinsing your produce will help with bacterial infections, but not with cyclospora. If you want to prevent cyclospora, you need to cook the produce or peel it, and unfortunately, you can't really do that with lettuce.
And why is it a good idea, again, to rinse all produce regardless?
Yeah, so it's to get rid of bacteria and other, soil contaminants, pesticides. So you do want to be rinsing off your produce, your fruits and vegetables before eating them.
Note to self, rinse produce more frequently, Major. I hardly ever do that, Dr. Gounder. Now I feel mildly ashamed. Thank you as always. I appreciate it.
Good to see you.